Good morning, dear student. So today we'll discuss on the topic cirrhosis. This presentation was made for the student of 6th semester MBBS. So before going to the topic proper, we'll start our presentation with this beautiful quotation that successful people are not gifted, they just work hard and succeed on the purpose. So I wish all of my students to work hard to be successful people in the future. So the flow of the talk of the today's presentation will first define what is cirrhosis and chronic liver disease, and what is the basic anatomy, physiology and function of the liver. Then we'll discuss what are the etiologies, causes of the cirrhosis. In the last part of the presentation, we'll discuss the clinical feature and some important signs of cirrhosis. So, going to the topic proper, let us discuss on the anatomy of the liver. In the right hand side, this is the gross anatomy of the liver. Liver is the largest internal organ of our body. It is around 2 kilogram organ. You can see clearly this ligament is a falciform ligament which divides the liver into the right lobe and the left lobe. It is the organ which is situated just beneath our right diaphragm and occupies the right hypochondrium, little bit part of the epigastrium as well as the left hypochondrium and the right lumbar region as well. In the left hand side, you can see clearly the microscopic anatomy of the liver. In the liver, this is the hepatic lobule, is the hexagonal in shape and the center portion of which is occupied by the central vein. In the pointed end of the hexagon, there is a portal fluid which contains the portal vein, hepatic artery and the common bile duct. Let us go with the more details of the microscopic anatomy of the liver. Now, what I have told, this is a hepatic lobule, and the central part of the hepatic lobule is occupied by the central vein of the liver. And from the central vein, you can see the vein going and connecting with the portal vein. And here are the sinusoids present. Sinusoids, which is lined by the endothelial cells. And in this point, in this area, there is a portal triad where there is a bile duct, portal vein and hepatic artery. And this will be one of the MCQ question, not only in this exam, but even in the MD entrance exam. So always be aware of this fact. If we go more detail into the microscopic anatomy of the liver, you see there are, these are the capillaries and these are the endothelial cells. And in between the endothelial cells and the hepatocyte, there is some potential space. This is the space of Gissé, which contains the stellate cells. It is one of the non-parenchymal cells. Once get activated, it can go into the progressive inflammation and can cause the fibrosis of this part. So when someone has the chronic liver disease or alcoholic liver disease, the alcohol, the major site of alcohol action is the stellate cells. It can activate the stellate cell and cause the formation of the fibers. Now let us discuss what are the functions of the liver. The functions of liver is it has metabolic function, like it has the functions of the carbohydrate, protein and the lipid metabolism. It can synthesize the albumin and the different clotting factors. So if someone has the liver disease, they can have the clotting factor deficiency and can present with the some feature of coagulopathy. Similarly, liver can store the vitamin B12 and it can store the vitamin B12. The normal storage of vitamin B12 in our body is for up to 3 to 4 years. It can even store the vitamin A and the glycogen. Similarly, the important functions of the liver are the metabolism of the steroids and the xenobiotics. We take so many toxins, so many medicines, and that most of the medicines are metabolized in the liver. So if someone has the liver problem, then they will have difficulty in metabolizing the drug, as a result of which they will have the side effect of the drug. And that is, it has also function in the bilirubin conjugation and the bile salt formation, which will be secreted into the bile duct. So if someone asks you what are the functions of the liver, then you have to tell these things. Okay. Now, can anyone tell what is the difference between these two pictures? So this one is the cirrhosis. If your teacher asks you what is cirrhosis, then you are not supposed to ask the cirrhosis is the presence of jaundice, like that. It's not like that. Cirrhosis is the histological diagnosis. If after doing the liver biopsy, if under microscopy, if we see the fibrosis and the formation of the different size nodules in the liver, and only we can say it is cirrhosis. You can see the fibrosis septa and the nodules, formation of the nodules. So cirrhosis is the histological diagnosis, whereas chronic liver disease is the clinical diagnosis. If someone has a feature of the liver dysfunction that persists for more than 6 months, then you have to tell the chronic liver disease. Okay. Okay. So this is the normal liver, and you can see. So what happens if the liver gets cirrhosed? It will be shrunken, it will be fibrous. Then what are the causes of the cirrhosis? Let us go one by one. The most important cause in the current scenario of our country is the alcohol. We take the alcohol for different reasons, but alcohol can cause the chronic liver disease. All the alcoholic people will not develop cirrhosis. You have to remember this fact. Only 15% of the alcoholic will develop cirrhosis. And if in case of male, if they consume 40 to 80 grams of alcohol per day for 10 years, then that can cause cirrhosis. And in case of female, the amount is little bit less. It's 20 to 40 grams per day for 10 years. Then that can produce a cirrhosis. So alcohol is the important cause of alcoholic cirrhosis. And if you are taking the history of any patient with CLD, then you should take the detailed history of alcohol intake, its amount, its duration, everything. Okay. Second important cause is hepatitis B and C. What do you think? Which one is the common, hepatitis B or C? Most of the time, cirrhosis is caused by hepatitis C. It's around 80% because hepatitis C has the chronicity, whereas hepatitis B has the self-resolutions. In most of the case, only in 5% of case, they can be chronic carrier and can cause the chronic liver disease. Okay, this is the one of the important fact that you people should know. So if someone has the hepatitis B, then you can wait for at least 6 months for the spontaneous resolution. But if someone has the hepatitis C, and that people may need treatment to prevent them from developing the cirrhosis. Okay. The another important cause of the cirrhosis is non-alcoholic fatty liver disease. In fact, it is the most common cause of cirrhosis in the Western world. Even in our country, with the increase in obesity, with increase in diabetes, and with increase in sedentary lifestyle, people are more prone for the non-alcoholic fatty liver disease. What will be the history in the day-to-day scenario? Doctor, I do not consume the alcohol. I do not take any amount of alcohol, but I have liver problem. Why is that so? In that scenario, one of the important cause is non-alcoholic fatty liver disease. Okay. Another important cause of CLD is cardiac cirrhosis. Cardiac cirrhosis is if you have a right-sided heart failure, the most important cause of which is left-sided heart failure. And from left-sided, it can come to the right-sided heart. Can cause the right-sided heart failure. There is the congestion of the blood in the liver for the long time, and that can cause the congestive hepatomegaly. And when there's a prolonged congestion in the liver, then fibrosis can occur, and ultimately that can cause the cardiac cirrhosis. Okay, so one of the cause of the cirrhosis is also the cardiac cirrhosis. Do you know what is this? Okay, so this is the another rare cause of the cirrhosis. So with the arrow, I am trying to show you the some brownish color ring. This is the KF ring, Kessler-Fisher ring, and you will get this condition in a patient with Wilson's disease. And Wilson's disease is one of the important cause of the cirrhosis that we often misdiagnose, or we often miss. So if someone has some neurological symptoms and the liver problem, then you have to always think of the Wilson's disease. If someone has the unexplained liver dysfunction, then you have to always think of the Wilson's disease. So always try to work out for the Wilson's disease. I think we often misdiagnose the Wilson's disease. Okay. Yes. So another important feature is primary sclerosing cholangitis. It usually occurs in young to middle-aged male and often associated with inflammatory bowel disease. Do people know what are the symptoms of inflammatory bowel disease? Yes. So ulcerative colitis is one of the inflammatory bowel disease which is usually present with the bloody diarrhea, and another inflammatory disease is Crohn's disease, which usually present with the recurrent abdominal pain. So if a patient say, doctor, I have a history of the bloody diarrhea, I passes the blood in my stool, and if the same person has the feature of the liver dysfunction like jaundice, and then that you have to always think of the primary sclerosing cholangitis as one of the cause for that condition. Okay. Another important etiology that we often misdiagnose in our day-to-day practice is autoimmune hepatitis. It usually occurs in female. So if female without no history of the alcohol, with no risk factor for hepatitis B and C, it comes to us with the feature of liver dysfunction, then we need to work out for the autoimmune hepatitis. Okay. And for that, we need to send different immunomarkers antibody, which can be tested even in our setup. Another important but rare cause is hematochromatosis. One of the rare cause. Theoretically, you should know, because some of the teachers are fond of asking the question, what is bronze diabetes, like that. Bronze diabetes means the person with hematochromatosis has a skin color of the bronze color skin, and they also have the diabetes. That's it, bronze diabetes, and this condition can also cause the cirrhosis. Okay. Another important cause is primary biliary cholangitis. Let us not discuss so much about these things. Okay, so tell me some of the causes of the cirrhosis. The important cause of cirrhosis, if someone asks you, you have to tell, you must tell alcohol, hepatitis, you must tell. Okay, so chronic alcohol intake and the hepatitis C is the important cause of cirrhosis. It's very good if you can say non-alcoholic fatty liver disease. It's very best if you can say the cause may be, sir, Hematochromatosis, Wilson's disease, autoimmune hepatitis, primary biliary cholangitis, primary sclerosing cholangitis. Okay, but to pass, you should know alcohol and hepatitis C as one of the important etiology of cirrhosis. Okay. Then let us go to the clinical feature, how the patient present in our day-to-day practice if they have chronic liver disease. In the asymptomatic phase, they do not have any feature. They may have just fatiguity, anorexia, nausea, vomiting, malaise, and like that. Okay, asymptomatic. So in fact, fatiguity is one of the most common symptoms of the chronic liver disease. But in our practice, most of the patients do not come in that state. They come only if they develop the symptoms, some complications of the chronic liver disease. So in the emergency room, you'll see the patient with this upper gastrointestinal bleeding, vomiting out of blood, passing the blood in the stool because of the varicose bleed. So one of the important clinical feature is the varicose bleed. So if someone present to you with a history of the UGI bleed, then you have to think of the CLD. Similarly, in our day-to-day in the OPD, patient usually present with the big abdomen and the swelling of the legs, ascites and edema, maybe the presentation of the CLD. Okay. Now, this is the important area because this is one of the stigmata of the chronic liver disease. So your teacher will ask you what are the stigmata of chronic liver disease, because these are the things that you need to examine, you need to see, and you are not going to see until and unless you have these things in your mind. So one of the important chronic stigmata of the chronic liver disease is parotid enlargement. You can see the parotid. Okay, these are the enlarged parotid. The cause of the enlarged parotid is the autonomic dysfunction of the parotid duct. The parotid duct, the mobility of the parotid secretion is not good, and there is stasis of these secretions in the parotid duct, and ultimately that can cause the enlargement of the parotid gland. And the proposed hypothesis is the fatty infiltration of the parotid as well. Okay. Your teacher will ask you, okay, tell me, so when do you say if the parotid is enlarged? This is a very tricky question. So for that, to say the parotid is enlarged, your lobule should be lifted off, and there will be the obliteration of the retrocanthal sulcus, retroauricular sulcus. There is a sulcus just behind the ear that should be obliterated. Only then you can say parotid enlarged. So if the ear lobe is lifted and if there is an obliteration of retroauricular sulcus, only you can say parotid enlargement. The cause of the parotid enlargement there are so many causes of parotid enlargement, but this is one of the stigmata of chronic liver disease that you should know. Okay. Okay, this is the spider angioma, and also called the spider navy. So where do you see it? Usually you will see this type of stigmata in the territory of the superior vena cava. Just in the upper part of the thorax, you will see the small like the spider web shaped enlargement of the capillaries, especially arterioles. These are the arterioles, and you can see the central part and the radiations from that central part. And this occurs because of the high level of estrogen in a patient with CLD, because there is not adequate metabolism of the estrogen in the liver. That's why if there is a raised level of estrogen, and that's why you can see this type of the stigmata in the upper part of the thorax. Then your teacher will ask you, okay, so how we will diagnose this spider navy? So spider navy can be diagnosed by diascopy. Diascopy means you have to just press with the glass slide, and if you press that glass slide, then there will be this thing will be vanish. After you release that, and again you will see this type of wave pattern. This is called the spider navy. So another question will ask you, another thing that you need to know it, what are the DDs of this lesion? This lesion may be the insect bite, maybe because of the some Campbell de Morgan spot like. Okay, these are some DDs of the spider navy, and the cause of the spider navy is not only CLD. If someone is taking OCP, oral contraceptive pills, if someone is pregnant, If someone has some thyroid problems, then you can see this type of lesions. So your teacher will ask you these questions. So another important is the gynecomastia. You can see the enlarged breast nodule in the male. If you see that, then you can say the gynecomastia is one of the chronic stigmata of liver disease. To say gynecomastia, you have to palpate the not a fatty portion of the breast. You have to palpate the fibrous portion of the breast, and the diameter of which should be more than 4 centimeter. Only then you can say there is a gynecomastia. So this is one of the stigmata of chronic liver disease. Okay, and don't forget to examine the breast. In case of female, there will be the breast atrophy. Another thing that your teacher are interested is we often miss to examine the axillary here, and there are usually loss of axillary here, and the mechanism of which is raised level of estrogen in chronic liver disease. So please do not forget to examine the axilla. Okay. Another is the very like thin skin. This is called paper money skin, and it's because of the decreased albumin level that can occur in a patient with CLD. Another is the Dupuytren contracture. You can see the Dupuytren. There's a contracture of the finger, and it occurs because of the fibrosis of the palmar fascia over there, and the cause are there are so many causes of the Dupuytren contracture. It's not only the chronic liver disease. You can see this type of Dupuytren contracture even in the trauma in the person who has the like mechanical oath. You can see, but if you see the Dupuytren contracture, then this is one of the stigmata of chronic liver disease. And please do not forget to examine this finding. Okay, another important finding is the palmar erythema. We can see the erythema of the palm, and the central part is pallor. This is again caused by the increased level of estrogen, and you can see this type of palmar erythema in so many conditions. Like other than the CLD, you can see this type of palmar erythema in a patient who have CO2 retention, who have polycythemia, like that. But in a patient with CLD or in suspected case of CLD, please do not forget to check their palm. Okay. Another important thing that you have to check in a male patient with CLD is you have to always examine the testis, and ideally you have to measure the diameter of testis with the help of orchidometer. It may not be possible in the exam, but you have to know the fact, okay, that you have to measure the testis. Okay, these are the different stigmata of the chronic liver disease. Let us revise a little bit. So in the today's presentation, what we have discussed is that we have discussed what is CLD and chronic cirrhosis. Chronic liver disease is the clinical definition. Someone has liver dysfunction for 6 months, then that is chronic liver disease. Like if someone has jaundice and that occurs for more than 6 months, then that's a chronic liver disease. But to say cirrhosis, actually we need liver biopsy, and if on liver biopsy, if you see the fibrous septa and different size nodules, then only you can see the cirrhosis. The more common etiologies of the cirrhosis or CLD are alcohol, hepatitis C, and non-alcoholic fatty liver disease. The most common clinical feature of the CLD is fatigability in the initial days, malaise, but in the advanced stage, they usually present with the history of UGI bleed or the distension of the abdomen and the anasarca. And there are some stigmata, physical examination, that we should never forget to examine. These are parotid enlargement, you know how to examine. These are loss of axillary here, breast enlargement in male and breast atrophy in female. Then paper money skin, palmar erythema, Dupuytren contracture, and the testicular atrophy. Okay, and there will be usually the presence of jaundice. Thank you for your kind attention.